Hello, this is the slice of the lung, and we're looking at a rather localized or a discrete mass lesion. I'm just going to rotate it for you and to show you that this mass really abuts against the visceral pleura. And on the opposite surface, you can also see the mass here. It is a little bit more irregular looking on this surface. Let me just turn this around and we're going to take a closer look at this mass. So it is an irregular pale tan mass that is fairly well demarcated from the lung parenchyma in most areas. In several areas, for example, here you can see that it is a little bit more ill-defined in terms of the interface with the lung parenchyma. The cut surface of this mass is kind of variegated, and we can see that there are some darker areas which represent hemorrhage, and also at the same time you can appreciate some areas that are actually paler than the rest of the mass, and these pale geographic areas are likely to represent necrosis. When we look at the relationship between the mass and the visceral pleura, we can see that it is very, very close. It almost appears to be touching it grossly, but it's not obviously going across it to breach the pleura, at least not from the gross appearance. When we examine the microscopy in this area, we can see better whether or not the visceral pleura is involved. So this is a single mass lesion located at the periphery of the lung. And when we see a single localized mass in the lung, we are always worried about primary lung malignancies. So the things we would be thinking of would be small cell carcinoma versus non-small cell carcinoma. Usually, small cell carcinoma favors the hilar region, although not always. Among the non-small cell carcinomas, we have squamous cell carcinoma and adenocarcinoma. Squamous cell carcinoma also tends to favor the more proximal region or the hilar region and the bronchial structures, but sometimes can occur at the periphery as well. Adenocarcinoma, on the other hand, is more likely to occur peripherally, although again sometimes it may occur more proximally. Only histology will be able to tell us for sure whether this is a squamous cell carcinoma or an adenocarcinoma. So in summary, we have a tumor mass that is irregular. It is located at the periphery of the lung. It abuts the visceral pleura, and it is fairly sharply demarcated, but in a few areas, the interface with the lung parenchyma is somewhat more ill-defined. And the main differential diagnosis here is primary lung carcinoma. If I were to see multiple masses in the lung, I would be more concerned about metastatic malignancy going to the lung.